My talk starts out a little morbid, but I promise it gets better, so stick with me. What if I could peer into a crystal ball and see your entire life, and that you'd most likely die from a specific disease, but that there was a free, safe pill that would cut your chances of getting that disease by up to 66%? What would you do? For 36 million people living with HIV who are immunocompromised, their number one cause of death is tuberculosis, the top infectious killer globally before COVID. Luckily, we can prevent tuberculosis with a pill called isoniazid, and that's where my dissertation comes in. In South Africa, where isoniazid is free and relatively abundant, people with HIV still aren't getting the pill. So I ran 3 experiments there to see if we could increase the use of isoniazid for people with HIV. First experiment, get patients to the clinic and in the door. We enrolled nearly 400 people with HIV who were getting routine tests, and for half, we did nothing. For the other half, we sent a secure cell phone message with their test results and instructions to return. And with this system, we persuaded nearly 3 times as many people who needed to come back to the clinic to actually come back to the clinic. So on to my second experiment, get nurses to write prescriptions. People are in the door, but before nurses can prescribe isoniazid, they have to run some tests. And one test in South Africa is particularly inconvenient. Patients have to come in twice, and nurses often have a hard time interpreting the test results. So we randomly gave some clinics a simpler test. Patients only needed to come in once, and nurses got a yes or no answer. And it worked. An absolute 25% more HIV patients got isoniazid when the test was simpler. All right, so patients are in the door, nurses are prescribing, time for experiment number 3. Explore ways to maintain progress. In this last one, we increased isoniazid by a relative 50% by hosting workshops for nurses and hiring another nurse to mentor them for a few months. After our study ended, though, all of these improvements disappeared. To better understand, I interviewed 10 nurses, and our main finding was that if we wanted to maintain this kind of progress, nurses wanted continued external motivation, like a permanent nurse mentor. So in conclusion, we got people with HIV in the door, we got nurses to write isoniazid prescriptions, and explored ways to maintain progress. And there you have it. You don't need a crystal ball to know that these 3 interventions can prevent tuberculosis to save the lives of people with HIV in South Africa.